Hi everyone, welcome to week 5 of your Pharmacology 1 course. This week we're going to be looking at the actual prescription itself. So the different things that we're going to be looking at is, the different types of prescriptions, medication orders, the difference between the different pieces of prescriptions versus medication orders, and the role of the pharmacist and the tech in filling a prescription. So the actual word prescription comes from the Latin, and it just means a written order. So in this case, it's the action of writing before you actually dispense the drug. Okay, so in our normal day-to-day actions, what we typically think of is any type of order that's either written, sent via computer or some other electronic, or a verbal order, giving instructions on how to dispense a drug to a patient. It is a legal document. It should have very precise information on it, and it can be used in court. So the written one is probably the one that most of us are familiar with. This is what's handwritten on a prescription pad. Anytime we have a handwritten prescription, it must be written in ink. And it has to be recorded in the patient's medical record on the doctor's side of it. So this is the traditional way that we see most prescriptions, and this is just a visual of that. So you can see the doctor handwriting that prescription. Handwritten prescriptions are, in a lot of cases, very difficult to read. We know that a lot of errors occur when handwritten prescriptions are presented. If maybe it's just because the doctor's handwriting is horrible, or it could be, because it's been tampered with. So, it's really important that if you have any questions about a handwritten prescription, that you reach out to the doctor and get those clarified. It is not uncommon for people to try to steal prescription pads and write prescriptions out. So it's very important to keep those prescription pads in a secure location. So, in a physician's office, they're, stored in a locked cabinet. The physician might only carry just one. You never leave them laying out. You only sign them when you're getting ready to actually complete the prescription, things like that. So computerized prescriptions are one of the ways that we avoid some of those problems. So it's actually goes straight into the doctor's software system. You can print it out and give that to the patient. You can also fax that directly to the pharmacy. So those are one way to prevent those errors that occur with handwritten prescriptions. Electronic prescriptions are not signed by the physician. It's different. They're digitally signed, and those are also faxed directly to the pharmacy. The verbal prescription is one that's given over the phone from the doctor to the pharmacy. It cannot be for a controlled substance, however, so we cannot have any type of verbal prescription given for a controlled substance. Now, a medication order is very similar to a prescription, but this is something that happens within a medical facility. So this is, something that's going to be used in, maybe an acute care setting, hospital, something like that, or even a long-term care setting, like a nursing home. This is an example of what a doctor's order might look like. So it's going to not only have drug orders on it, but it might also have things about maybe physical therapy, things along those lines. A lot of times those medication orders are given verbally, and if it is a verbal order, it will be noted as such on the actual order. They might have a standing order. So a standing order is something that they're going to have, always for this particular patient or in this particular circumstance. Automatic stop orders are specific to certain types of drugs. Specifically controlled substances are ones that will have an automatic stop. So they only are for a certain number of days. Then at that point, then the pharmacy knows to stop sending those drugs. Anytime a patient's situation changes, those automatic stops will also go into place. Now, this is an example of a prescription form. There's lots of different components on a prescription form that you're going to be looking at. You'll always have the doctor's name, address, phone number, a place for the patient's name, address, the date, whether or not a refill can happen, whether or not they can substitute a generic, a signature for the doctor, and a place for the doctor's DEA. So a pre-printed prescription pad is most common. When you talk about a medication order, it's going to have the patient information already pre-printed on that order sheet for the most part. So these are just some of the similarities and differences between those. So as you go through this week and you review all of these different things and the components of the prescription versus the components of a medication order, how to read them, some of the other safeguards and things like that. If you have any problems or questions, please make sure that you reach out to me, and have a great week.